Hello, future PTAs. Hope you guys are doing well. Today we are going to talk about electrical current for pain control. So primarily we're talking about TENS and interferential current. So this is our outline for the day. Transcutaneous electrical nerve stimulation. This is what we call TENS. This is electrical stimulation to modulate pain. It modulates pain through gate control. It activates the non-nociceptive A beta neurons, and this is at the level of the spinal cord. It inhibits a transmission of nociceptive signal at that level, and it causes opioid release. So when a non-nociceptive stimulus, so non-painful stimulus, occurs often enough and at let's see, at enough intensity is the word I'm looking for, to activate inhibitory interneurons in the spinal cord, then it inhibits the transmission of that painful signal, and it keeps it from traveling from the dorsal horn, which is in the spinal cord, up to the brain. So it keeps the brain from being being notified of that painful stimulus. So it's called pain gating because it's like it opens the door for the non-painful stimulus and closes the gate or the door to the painful stimulus at the level of the spinal cord. It does not allow it to travel up to the brain and be made aware and felt by the patient. So conventional TENS is also called high rate TENS. It has a shorter pulse duration of 50 to 80 microseconds, a higher frequency of 100 to 150 pulses per second, and the amplitude needs to be high enough to feel a tingling sensation without causing any twitch of the muscle, any motor reaction, or without causing any pain. So it is pretty much primarily only effective while it is on, but the good thing is it can be worn all hours of the day. So typically this is the type where people have home units what they wear when they need to and as long as they need to. The only lasting benefit that it can produce is it can interrupt the spasm pain cycle. So there is a cycle of when people are in pain, their muscles get tight, more guarded, and could spasm, which causes more pain. And then it just continues that cycle. So if the pain is decreased, then it can also decrease the muscle spasms and then that painful cycle, which would be one lasting benefit. Otherwise, it primarily only benefits the patient while it's being worn. With low rate TENS, this is a repetitive stimulation of motor nerves. So you're causing the muscle to actually twitch. It stimulates the endogenous opioid production and release. And so the opioids that are released are endorphins and enkephalins. They bind to the opioid receptors in the brain and other areas and act as neurotransmitters and neuromodulators in order to decrease that painful signal. Another system called the non-opioid system has descending inhibitory pathways that are also activated, such as with serotonin. That is one of the chemicals released there that helps activate that system, and all of those lead to decreased pain. So with low rate TENS, the parameters we typically use, it has a longer pulse duration of 150 to 300 microseconds, a lower frequency between 2 to 10 pulses per second, and a high enough amplitude in order to produce a muscle twitch. The good thing about this type of TENS is that it is typically effective for 4 to 5 hours after the stimulation ends. But you do not use this type for more than 30 minutes at a time because it can create delayed onset muscle soreness. So if you want that acupuncture-like TENS, then you would need to turn this same type of stimulation up high enough to be painful. So with low rate, it's strong, it's causing muscle twitches, but it shouldn't be painful. With the acupuncture-like TENS, you need to turn the intensity up high enough to where it is painful for the patient. And that also activates the opioid system and causes those lasting benefits. One issue with this type of TENS is whether you're using just low rate or acupuncture-like TENS, is that when it is used frequently by the patient, they can build a tolerance to this type of stimulation. And so, in order to decrease the likelihood of them building a tolerance, you can change the frequency and the rate frequency in order to help kind of throw their brain off and not just get used to that stimulus and no longer respond to it. So they can develop a tolerance. If you're trying to keep them from developing a tolerance, then one way is to modulate the frequency in the parameters. Okay, making sure there's nothing else I didn't want to skip over. Okay. Burst mode TENS, this is where the stimulation is delivered in burst or packages. So it has the same mechanism and most of the same parameters as low rate TENS. It can be more effective, but it's typically a little more painful, not tolerated as well by the patient because of the way that the stimulation is delivered. So this very top picture is our conventional TENS that can be worn all the time, that causes benefits while it's on, but not real lasting benefits. The middle picture is that low rate TENS that only needs to be applied for up to 30 minutes to avoid that delayed onset muscle soreness. And it can have lasting effects in decreasing a patient's pain for 4 to 5 hours after it's removed. This burst mode TENS, not to be confused with beast mode. This has very similar parameters to the low rate TENS. Typically, the frequency that they use is preset in the machine around 10 pulses per second. The duration is typically 100 to 300 microseconds. And once again, you do not want to have this type of stem, this burst mode stem, on for more than 30 minutes at a time, but it does have lasting effects if the patient can tolerate it. Electroacupuncture, this is where they place electrodes on the skin over acupuncture points. So you can actually place needles in the acupuncture points and then connect the needles to electrodes and do electrical stimulation through those needles. It requires special training in order to be allowed to even place those needles. So typically in PT, we typically don't use a lot of acupuncture. What we use is dry needling, which is a longer needle and it goes all the way to the bone and has a little different effect than acupuncture. So the only issue is typically PTAs cannot at this moment get certified in dry needling. Only PTs can. And so I wouldn't worry too much about the electroacupuncture because at this time PTAs cannot get certified in dry needling in order to do some type of a similar effect. But the effect it has is it promotes the endorphin release to decrease pain. So when we use it, why do we use it? So with acute pain, TENS can help control postoperative pain. It can help reduce the amount of pain medication that someone takes. With chronic pain, it can help control the pain associated with certain conditions like osteoarthritis or diabetic neuropathy. Another one is migraines. If you place the electrodes over certain places in the neck and face, there have been studies that show benefits to people who have chronic migraines. So there's a lot of different applications for the use of e-stim for pain control. The contraindications and precautions are the same that we've already discussed for all electrical stimulation, But in addition to that, you do not want to create a motor effect or use the low, um, now I'm losing my words. What is it called? Low rate. Yep. Low rate. Yep. You don't want to use that low rate um, TENS and create a muscle contraction in a muscle that is either, torn or has just been surgically fixed, because you don't want to disrupt or delay that healing. So if the tissues are really fragile and you could cause, but by creating a muscle response, cause them to tear apart, then you certainly don't want to do anything that creates a muscle contraction there. So just be careful with patients who've recently had surgeries or are healing in the beginning stages. All right, so pulsed biphasic and interferential current are the waveforms that we use for pain control. One thing I want to clarify about IFC versus TENS. I previously mentioned that the book said that IFC was alternating current and TENS was pulsed biphasic current. Both of them are actually pulsed biphasic current, so I'm sorry for any confusion that caused. TENS can have the same electrode placement as IFC, where you have them crossed like an X. But what makes it IFC and what's different is the alternating current of the two lines have different frequencies. So like one might have, in this example, 5,000 hertz and the other 5,100 hertz. So that creates that beat frequency of 100 hertz in the middle, which can go deeper than TENS and be more comfortable for a patient than TENS. So that's why we might use IFC, but you can use a TENS unit, some TENS units, depending on their settings, to still do IFC and get that beat frequency. So both use the same waveform. So I'm sorry for the confusion there. Pulsed biphasic current. Both of them can use an X pattern of electrode placement. So that is actually the most commonly used electrode placement for TENS. However, only IFC uses those two different frequencies that create a beat frequency that goes deeper and is more comfortable. So let me know if you have questions on that. With the application techniques, so you want the electrodes to be placed over the painful or surrounding the painful area. In order to be IFC, the channels must cross. A lot of your TENS that's not IFC, you still cross the channels, but you could have them parallel, just depending on where the pain is and what effect you want. The electrodes need to be at least, at very minimum, 1 inch apart. You can place the electrodes over trigger points or acupuncture points. Sometimes that's more beneficial with pain control. And if the patient can't tolerate having the electrodes placed directly over the painful area, you could place them proximal to that painful area and in the same pathway of that's supplied by that sensory nerve. So whatever nerve supplies the area where they're painful, if you get in that same sensory pathway and put it proximal to that, it could create similar effects. Our parameters with conventional or high rate TENS, you want to have 100 to 150 pulses per second as the frequency, 50 to 80 microseconds as the pulse duration. And the amplitude, you want it to be high enough for them to feel something, especially a tingling, but not high enough to create any type of pain or muscle twitch. And with this type of TENS, you can use it as long as you want, but the benefits only last while it's on. Versus with low rate TENS, it's typically 2 to 10 pulses per second, 150 to 300 microseconds as your pulse duration. You want to turn the intensity up high enough in order to get a twitch, a muscle twitch, and you do not want to use it for more than 30 minutes every 2 hours, which obviously if they're doing it in the clinic, they're not going to come back in 2 hours. But if they have a unit to take home, I would instruct them, do not do it. At least wait 2 hours after you have applied the TENS before you do it again. With that duty mode, if you remember, it is similar to the low rate. It's typically preset at 10 pulses per second and somewhere between 100 and 300 pulse duration. You also want the motor twitch. You also want them to only use it for up to 30 minutes at a time. And it's a little bit more uncomfortable for patients, so you want to be aware of that. But both have lasting effects. So the low rate, whether it's duty mode or not, both have lasting effects that can help decrease a patient's pain for up to 4 or 5 hours after use. All right, low rate versus conventional. With conventional, you feel the benefits only when it's on, versus low rate, you can have benefits for up to 4 or 5 hours after the treatment has finished. There is very low risk to conventional TENS. It's sensory only. It's not creating a motor response, versus with the low rate TENS, it could cause delayed onset muscle soreness, or if there is a very fragile tissue, it could possibly tear that tissue again if it's turned up too high. With the types of conditions that are treated by conventional TENS, we're typically talking about more acute conditions or repetitive strains. Versus with the low rate TENS, we're usually talking more about chronic conditions, and you do not want to use it with repetitive strains because it can just kind of flare it up more. With conventional TENS, you can use it up to 24 hours a day if you want to, versus the low rate TENS, you do not want to have a duration of more than 30 minutes to avoid delayed onset muscle soreness. When you document your treatment through TENS, you want to document what area you treated, what position the patient is in, what parameters you used, including the amount of time, where you place the electrodes, and the patient's response to their intervention. So that is our lecture for today, and I will see you in the next lecture. It's always hard for me to stop.